Hello everyone, I want to take this time to review with you and go over Alachua County's proactive approach to reduction of firefighter cancer. In recent years has been brought to the forefront in our attention of some of the things that are causing and increasing the firefighters' chances to getting cancers. So one of the things that a lot of the research has been done is to look at how we can prevent this versus treat the cancers and some of the things that we can do. So one of the first things we want to look at is what exactly happens at structure fires and the combustion products at structure fires that can create some of the problems. As you can see here, we have some of what we call the methyl ethyl bad stuff, things from arsenic, asbestos, benzene, butadiene, the dioxins, formaldehyde, polycyclic aromatic hydrocarbons, vinyl chloride, as well as other things as bad like styrene, toluene. So there's three major potential entry routes for fire, smoke, and other contaminants into the body. As we've learned through many of our paramedic and EMT schools, we have dermal, absorption, inhalation, and ingestion. We'll talk a little bit about absorption through the dermal, and that means penetration or permeation around your turnout gear. There have been studies that have been done using fluorescent aerosols and sprayed around a person wearing turnout gear before and after exposure. You can see with the pictures that these are similar to some of the other studies done by NIOSH and the University of Cincinnati, that some of our most prone areas are around our hood, which go down around our neck, our jawline, our ears, around our gloves, around our waist, and then down into our legs and groin areas. So let's talk about some of the impacts and what's been found by other departments. Chicago and New York fire departments now require a routine laundering of hoods. As well as here at Alachua County Fire Rescue, you'll see that each individual fire certified person has been issued 2 emergency protective hoods. Several other departments have implemented hood exchange programs. And there's 4 major turnout gear manufacturers that are evaluating other hood materials that would provide better dermal exposure protection. And we at ACFR are also looking into some of these hoods as well. The Firefighter Cancer Support Network recommends cleaning the neck and skin with some sort of a baby wipe following the response within an ideal H. So the University of Cincinnati, who's provided a study and done research, has come out with a report for firefighters' cancer and skin protection. After fires, the skin is soiled, most often with the plasticizers and fire retardants. The origins of most of these come from household plastics and treated fabrics. There's a direct connection with firefighter cancers. These chemicals have been found in animals to cause prostate and testicular cancer. These are 2 of the most frequent cancers in firefighters. So one of the major parts in cancer prevention is to remove the chemicals from the skin. The skin absorbs most of the contaminants, and the absorption rate is much higher and is very strong at fires at high temperatures. Part B of this is to remove and replace soiled gear. Soiled gear can still contaminate the skin even after out of the ideal H. So you can see with the study that was done by the University of Cincinnati, skin absorption varies by the region. And looking at this chart, you can see the scalp, forehead, the angle of the jaw, and the scrotum are some of the highest areas to absorb in the test of hydrocortisone. This finds to be true to other contaminants. You can also see through the study done by the University of Cincinnati, the soiled hoods, when they did a research study and chemical analysis of these hoods, some of the most abundant chemicals found. These are the orthophthalate plasticizers. So some of the recommendations that came out of the study from the University of Cincinnati were firefighters face increased risk of cancer, including that of the prostate and testes, increased heart disease, and they have adverse developmental outcomes. They found that these can be reduced if you use the SCBA throughout the fire suppression, including overhaul, and avoid skin contamination or rapidly remove it after fire events. Part of their prevention suggestions are wear your air, take a shower, and wash your gear. Some of the recommendations that came from the study through the Commission of the International Association of Firefighters were to minimize dermal exposures. This can be done to clean visibly soiled gear that could contact skin, which includes your hood, to wash your hands and shower as soon as possible following a response, to be sure to put on clean station uniforms after showering, launder hoods, or have a hood exchange program. Here at ACFR, we are initiating the Wash Your Hood Sunday, which means that all personnel should wash their hood, regardless of its state, every Sunday that they work. They have a second hood that was issued to them to be used while their other hood is being laundered and dried. We also have a program for the routine laundering and decon of turnout gear, and if your gear is soiled, be sure to scrub it off, clean it at the station, and if necessary, take it to one of the stations and utilize the extractor. To minimize inhalation exposures, one should be sure to wear their SCBA. We should rehab away from off-gassing gear. Do not store gear in personal vehicles or personal spaces. Remain upwind of fires if not directly involved in the fire response, and then provide natural ventilation to structure after suppression. So the recommended action, here's some of the things to consider. Wash up on scene to remove gross contaminants. We should use water and soap on the fire scene to clean yourself before you return to the station and take a good quality shower. Hand soap and degreaser can be easily kept on the fire apparatus. Keep sunscreen on all apparatus. There are many times throughout the year that each crew is going to be out in the sun for extended periods. Using sunscreen during these times will decrease your risk of receiving a cancer diagnosis. Also consider bringing a hat along with you. The post-fire shower. Take a shower as soon as possible when you return from a fire. Carcinogens are absorbed into your body, and immediately showering post-fire is the only way to get them off your skin. Be sure to change your clothes post-fire. Not only must you shower after a fire, but also put on a new set of clean clothes. Doesn't make sense to recontaminate yourself by putting on the same soiled clothes. These clothes are ideally washed in a washer and dryer at the firehouse and not taking home and cross-contaminating them with your civilian clothes. So post-fire decontamination of fire apparatus. We all have checklists of things to do when we return to the station from a fire, whether it's load hose, fueling a fan, and so on. We should also clean the inside of our cab if we placed our soiled fire gear inside, as well as clean our SCBA. By decontaminating the interior, we will not contaminate ourselves and our fellow crew members. So what are we doing at ACFR? We want to wash our hoods regularly and after a fire. All personnel shall wash their hoods on Sunday regardless of use, even if it was kept in a gear bag. We also want to wash after any exposure to an IDLH atmosphere. That means after any fire. We issue a second firefighting hood for all Firefighter 2 certified employees. So all personnel who could be used within an IDLH. The use of decontaminant wipes. You will find that decontaminant wipes are being distributed for all fire companies. These firefighter wipes shall be placed on all fire apparatus for immediate wipe down following fireground operations within the IDLH. The placement of soap on all apparatus for immediate washdown of high contaminant and transmission areas, face, hands, neck, and arms, and gross decontamination of equipment. The use of sunscreen. Sunscreen is available from CSW and should be kept on the apparatus for use. The wipes that ACFR has chosen are rescue wipes. And here you can see the dedication to prevention of cancer and safety begins with using only premium ingredients to help remove soot, smoke, and harmful toxins from the skin. The wipes selected, rescue wipes, do not contain alcohol, parabens, latex, antibacterial properties, or any kill formulas. They contain several ingredients that make up healthy all-purpose body wipes. Rescue wipes are safer than most body wipe products on the market, and the combination of premium ingredients mixed with high-end, all-natural materials derive a healthy and effective body wipe. These are not to be used for personal or station use, not to be used in the restrooms, and not to be taken home for the use on your toddlers and youngsters. Please remember to use these accordingly, and we ask that you use them as needed. However, do not abuse the ability to have these. So we'll first talk about the firefighter decon process. So step one, you're going to take the rescue wipe from the packet and fully open it to take advantage of the entire wipe. If both sides of the wipe become soiled in the cleaning process, we do expect you, and it is okay, to use additional wipes as needed. Step two, you want to be sure to start with your eyelids in the external quarters around your eyes. Rescue wipes contain no alcohol, parabens, or harmful chemicals to further irritate or harm your skin. You want to clean your hands, lips, and surrounding skin and your face before hydrating. Use the foaming action to pull the contaminants off your face. If you are thirsty and cannot wait to hydrate, be sure to clean your hands off before grabbing a beverage. Step 4. Be sure to get the inside and around the back of your ears, but don't use any small or pointed objects as you can damage your eardrums. Step 5. Get all around your neck and make sure you get all sides as well under the collar of your shirt. Step 6. Remember that your nose has a lot of blood vessels close to the skin. These can easily absorb contaminants. Clean the inside and around the folds of your nose. However, note, you'll blow your nose on the wipe after you've completed following all of the following steps. Step 7. Wipe down your hair. Use your fingers to help comb out any debris that could be found there. Step 8. Use a clean side of the wipe to thoroughly clean your arms. Be sure to mop up the soot and debris and not just spread it around on your arms. Step 9. Clean your hands and be sure to get in between your fingers and underneath any rings, bracelets, watches, etc. Step 10. Make sure to get as much of the debris out of your fingernails. And be sure to use a cleaning brush when you're able to take a full shower back at the station. Step 11. Underarms and groin are dense with hair follicles and very important to clean since they can capture and hold debris. Step 12. The rescue wipes are safe for the entire body, so be sure to wipe down below your belt and into your groin to remove as much debris as possible. Don't forget, at the end, to blow your nose. So just to review some immediate actions that you can take to protect yourself from cancer. Number 1, use the SCBA from initial attack to finish of overhaul. Not wearing SCBA in both active and post-fire environments is the most dangerous voluntary activity in the fire service today. Number 2, do a gross field decon of PPE to remove as much soot and particulates as possible. Number 3, we're going to use the fire wipes, the rescue wipes, to remove as much soot as possible from our head, neck, jaw, throat, underarms, hands, groin, waist, and neck area while we're still on the scene. We want to change our clothes and wash them immediately after a fire. Shower thoroughly after the fire. Clean our PPE, gloves, hood, and helmet immediately after a fire. Do not take contaminated clothes or PPE home or store it in your vehicle. Decon fire apparatus interior after the fires. Make sure to keep bunker gear out of the living and sleeping quarters and stop using tobacco products. And lastly, remember to use sunscreen or sunblock. The importance of an annual medical examination cannot be overstated here, and the early detection and early treatment are essential to increasing survival of cancer.